Okay, y'all. Trying to help everybody out the best I can. This is going to be chapter 85. We're talking about AIDS and HIV. Just follow along with the outline that I'll be sending out. Well, this outline. So, boom. The introduction. So, what we know about HIV? Well, we know that HIV, this is an immune system. Well, first of all, we know the immune system. It protects the body from adverse effects of invasions by the microorganisms and other foreign substances. It also regulates the removal of damaged cells and disposes of abnormal cells that arise within the body. One disorder that affects the function of the immune system is HIV. HIV is going to invade the body due to the fact that the immune system is unable to function. So the immune system is not functioning the way it should due to the HIV cells invading the cells that help with the immune system. It helps fight off whatever needs to be fought off. But the HIV cells are strong and it's killing those cells. So we'll talk about the cells that are getting killed in a second. So anyway, the virus it invades multiple. It invades and it multiplies and it proliferates throughout the body, becoming increasingly destructive because the protective mechanisms of immunity are ruined. And the protective mechanisms are those type of cells that help fight off certain infections or just help us fight anyway to keep us prevent us from getting sick. So those cells are destroyed by the HIV cells. HIV is not curable. We already know that. It's no cure for it. And there's many medications that help slow the progression of the disease down. There are two types of HIV. You got HIV 1 and you got HIV 2. Now, one, that is a viral form. HIV 1 is the viral form of HIV that causes the majority of infections in the US and worldwide. So, when you think of HIV 1, just when somebody say HIV, that's the same thing. When they just say I have HIV, or well, not I, but they have HIV. It's just the same thing. It's just HIV. But HIV 2, aka HIV part 2, it is less violent form of it's a less violent form of HIV that infects fewer individuals. Okay, so both forms are going to be transmitted through direct contact with HIV infected body fluids or through HIV infected mother to the child during pregnancy, or it can be due to delivery or just simply breastfeeding. So HIV 2 infections, they generally take longer to progress to symptomatic HIV, which is one, or to AIDS. It has a lower mortality rate rather than HIV um, 1 infection. So HIV 1, if somebody got HIV 1, that mortality rate is higher than 2. 2 is it's like it comes on slowly. It takes longer for it to turn into HIV 1 and for it to then turn into AIDS. And then with AIDS, we know that is the most advanced and final stage of HIV. So when somebody get when that HIV 1 turn into AIDS, you know it's bad. It is the most advanced and final stage of HIV, and then I ain't no telling how long they live after that. Everybody is different. So not all persons with HIV will get to the advanced stage of, with the medical treatment and doing what they supposed to do. Um, they probably will never see AIDS. So the history of HIV, they talking about monkeys and shit, chimpanzees. They found this shit in West Equatorial Africa. I don't believe it, but that's what it is. If y'all want to read over these slides, y'all can read over them. I just do not believe that this is what took place. So basically, they was out there in Africa. Damn monkey had something called Samian immunodeficiency virus, and the animal virus was then transmitted to the humans and mutated into HIV. So I'm like, how the hell did that happen? Like, was they out there having sex with the animals? Like, how in the hell did that happen? Or were they killing the animals and eating them? Were you killing chimpanzees and eating them? It just doesn't sound right to me. I never believed that AIDS came from a monkey. That shit came out of a lab somewhere. But that's a whole nother damn story. Okay. So boom, it ain't hit the United States like really, really hit us. until like the mid to 19 mid to late 1970s. Now the shit been out since the 1800s, but in the United States, the virus is known to have existed in the mid to late 1970s. That that had a lot to do with the gay men and stuff like that. Not saying that only gay men get it, but it was a large amount of numbers of gay males getting HIV or whatever. So in 1982, that's when AIDS came about. It turned from HIV to AIDS in 1982. CDC is the ones that formally tracked AIDS, and in 1983, that's when an international team of scientists, like from all over the world, discovered that the virus um, that led to AIDS. So in 1983, they discovered that that HIV led to AIDS. The virus was eventually given the name of the human immunodeficiency, or HIV. So let's talk about the actions of HIV. So we know that HIV. Um, did I even record? Let me make sure. Oh yeah, I'm recording. So we know that HIV is an infection with human retrovirus. That's probably important, but what's really important is we know that what HIV does, it invades healthy, it invades healthy and normal white blood cells. The virus uses its own RNA to change the healthy cells' existing DNA. So HIV has RNA, doesn't have DNA, it has RNA, and it uses its own RNA to change the person's DNA into cells, and the shit just replicates. And that's when the virus overtakes the biosynthesis in existing cell to duplicate and spread the HIV within the body. The That might be important, so I'm gonna highlight that. A reverse transcriptase enzyme is necessary to convert the virus RNA into DNA. So it has to be a reverse transcriptase enzyme there in order for that virus to convert the RNA into the DNA. So it's changing the DNA by converting the virus RNA into the DNA. So the HIV is going to invade the normal cells. Now let's talk about these cells that, like I was telling you about, how we're getting to the cells that we need in the immune system to help us fight off different type of infections. So we're about to talk about this now. So the HIV invades a normal cell. It inserts its RNA into the cell, right? So the RNA goes into the cell and is taking over the DNA. So and uses that cell's life-sustaining biomechanism to convert RNA into DNA. So it's like it's wiping out your DNA. It's wiping out your DNA. That's pretty much what it's doing. So the HIV cells are created and are then able to reproduce new HIV cells. Doesn't this sound a lot like not like Christmas, but doesn't this sound a lot like cancer? Sound just like it. So the HIV cells are created and are then able to reproduce new HIV cells. The original purpose or function of the normal white blood cells is destroyed. Going back up to that first thing I said, when the cells, the white blood cells we need to help us fight off these infections, they're destroyed by the HIV cells. So HIV has a highly sophisticated structure. If you look at the figure in 85-1, like is when we say highly sophisticated, if you turn the page in the new book 15 10, you will see the structure of the that HIV cell. It's highly sophisticated, meaning like it's hard for DNA to fight that cell. It is hard. Well, it's hard for your own cell to stay, you know, it, to stay normal, to stay and do what it needs to do. HIV, put it like this: HIV are some strong ass cells, and they will beat the shit out of your cells when they get into your body. That's what happens with HIV cells. They are highly sophisticated. and they will turn your cell out and kill it and get that, and then boom, take the fuck over your body. So HIV has a highly sophisticated structure. Like I said, the retrovirus commonly invades two types of cells. This is important to know. T cells and B cells. Those are lymphocytes. Those are some white blood cells. The T cells, lymphocytes, they mature in the thymus. That's what the T stand for in T cells, the thymus. And then you got the B cells, the lymphocytes, they originate in the bone marrow. So when you see B, those are the bone marrow cells. B stand for the bone marrow. So the lymphocytes are one of the five types of white blood cells. Now you can find that in the figure 23 dash. Oh, no, we ain't going back there. But yeah, so lymphocytes, they become many types of specialized um, cells for T cells, B cells, and CD4 cells. Normally, T cells and B cells function to fight infection and to produce antibodies for the specific immune response. That's what they normally do. Normally, T cells and B cells, they in your body fighting off infections, whooping ass, right? Every time you get sick. And they produce those antibodies. Those antibodies that we need when those foreign objects, those antigens come into our body. That's what they normally do. And the main cells affected by the HIV are the helper T4 cells, lymphocytes, better known as CD4 cells, and HIV destroy the CD4 cells. And basically, what a helper T4 cell is, it's like an immature T cell. That's all it is. It's an immature T cell. It's not fully developed, but when the body, so basically, what the HIV does, it's going for the immature as T cells, which are the T4 lymphocytes, and it's getting them before they even become mature enough. So yeah, it's getting the baby. It's like the mama is the T cell, and the T4 lymphocyte is the baby cell, the helper T4 lymphocyte, aka the CD4 cell. It's the baby, right? But the HIV, it ain't gonna mess with the mama T cell. It's gonna go to the helper T4 lymphocyte, aka the CD4 cell, and it's gonna get the child. It's gonna affect the child. So the immune system is increasingly depleted as CD4 cells are destroyed because you don't have any new lymphocytes, any new helper T cells coming out. So these T cells, they are getting old, they're getting mature, and they're passing on. But now all these cells right here that we was waiting for them to grow up and get grown and do their thing, they can't help because they have been taken over by HIV. They have been destroyed by the HIV. So when the HIV infected person CD4 count falls below 200, so know that when the HIV infected person CD4 count falls below 200 and or the client has developed unusual infections, sees opportunistic infections below, we'll see that in a second, the diagnosis of AIDS is confirmed. So when that infected person, CD4 count, falls below 200, and or the client has developed unusual infections, that's AIDS. That's the diagnosis of AIDS. HIV differs from most viruses for a variety of reasons. It produces and mutates rapidly, which results in a multiplicity of HIV genetic variations in a single person. Several variations can occur within one client at any particular time. HIV has three primary infections: acute HIV. No, I'm gonna do it like this. HIV has three main stages. Three main stages. You got primary, which is acute. The shit came on fast. You got chronic latent infection. Um, it came on slow or whatever. And clinical latency, aka clinical latency or inactivity. Like I guess that's the one that's like when they say they're dormant. Yeah, it lies dormant. And then you got AIDS. So the primary acute infections occur typically 2 to 4 weeks after initial exposure to virus. So that shit came on fast. Somebody went out there and had some rough, unprotected sex or used a needle or something that they wasn't supposed to use, then bam, guess what the hell happened? You wasn't feeling good. You go to the emergency room, they get to taking blood tests and doing all this shit, call you the next morning or a couple of days later and say, hey, player, you got HIV. So that's what happened. And that shit came on fast. It didn't even sit in you for a while. It wasn't chronic. It wasn't Latin. It wasn't inactive. The shit was active. Hold on. Okay, so my bad, y'all. I had to take a phone call. But anyway, where it says primary acute infection, that's where we're going to start at. So right here. So with the primary acute infection, it occurs typically 2 to 4 weeks after initial exposures to the virus. Now, the client, they're going to complain of a flu-like symptom, such as a sore throat. So they're going to think they got the flu. Mild fevers, aches, all that stuff that you get with the flu. Mouth ulcers, rash, night sweats. And some individuals may have no symptoms. The immune system, I'm gonna highlight that so y'all can know what the complaints are. The immune system begins, the immune system brings the virus to the lymph nodes where most viruses are going to be destroyed. But what happens is that ain't that ain't going down in the immune system. When the immune system bring those viruses to the lymph nodes, that ain't what's going to happen. When HIV come up into there, let me tell you what happened. However, HIV has begun to invade the cells within the lymph nodes and start making copies of itself, which are released to the general circulation and travel to the bloodstream to release more invaders. That is what's going on. At this time, the viral count of viral load, that is the amount of the virus is in the amount of virus in the body is significantly high, right? Significantly high. HIV positive individuals are infectious. I like that whole thing. Since the person often ignores or is unaware of symptoms, the chances of transmitting that shit is so high, very high. Chronic latent infection follows the acute phase. The virus become less active. The individual appears to be healthy, often for many years following the initial infection. The viral load may be clinically undetectable. So that's when I say it lies dormant. I think the word is dormant. When people are like, I'm dormant. Well, not me, but I ain't got this shit at all. I'm just saying. When people say they are dormant, or yeah, they don't have anything. I think I'm saying it right, dormant. Clinically undetectable. But HIV is active and infectious. So, it may be lying undetectable. They may be undetectable, but they still got this, they still got it. They still got HIV. If untreated, HIV depletes an individual immune system over a number of years, allowing the development of both minor and major infections and cancers, eventually leading to death. So they have to treat this or they're gonna die. It's gonna turn into AIDS and that's it. And you're gonna get sicker and sicker and sicker and you're gonna die. In an untreated person, the average time for acquisition of HIV until a diagnosis of AIDS is about 10 years. Okay, so they got about a good 10 years. However, this time frame varies from years to decades among individuals who are treated with the highly active set of medications. So if they're being treated good, it's not this ain't about them. You taking your medicines like you should, you probably keep HIV forever. AIDS is the last stage of the disease. We already said that. It is characterized by severe damage to the immune system. AIDS is AIDS is severe system. I mean severe damage to the immune system. Life-threatening infections, which would not occur in individuals with a normal immune system. Take advantage of an ailing immune system and develop into opportunistic infection. Okay, let me read that again. Life threatening infections, which will not occur in individuals with a normal immune system, take advantage of an ailing immune system and develop into opportunistic infection. As a direct consequence of HIV invasion, the individual is vulnerable to many opportunistic infections. So if you see that OI, you know there's opportunistic infection. Opportunistic infections and cancer accounts for a large portion of deaths related to HIV. So if you go to box 85-1, it's somewhere on here. I think it's this one. No, we'll come up on it because I think that said box. Does that say box? Yeah, that said box. I will come up on it. I got it somewhere in here. Let me see. Now we need to look at the opportunistic effect. Here we go. Let's look at this real fast. I probably need to switch it around. But we're gonna look at this real fast. So opportunistic infections and conditions related to HIV and AIDS. So you have bacterial infections, right? So with the bacterial infections, we're going to read through all of these because all one of these may be on the test. So if you don't read it all, you're not going to know if you see it on the test. So opportunistic infections and conditions related to HIV/AIDS. You can pause the video and just sit here and look at them on your own, but you need to look at them, every single last one of them. Let's begin with bacterial infections. Bacterial diarrhea. You see what all that is. There may be a bacteria diarrhea. Bacterial pneumonia. I think that's Mycobacterium avium complex. Mycobacterium can say, what is that? Can Sacy? Can you get out of here, champ? Get, get out. My bad, y'all. Syphilis and neurosyphilis, TB. That's all for the bacterial infection, for the viral infection. You got cytomegalovirus, hepatitis C, herpes simplex virus, oral and genital herpes zoster virus, shingles. That's what herpes zoster virus is. HPV. They may have, and with the HPV, genital warts, anal cervical dysplasia, cancer. I may have molluscum contagiosum, molluscum contagiosum, oral hairy leukoplakia. They may have, so I think that's their hairy tongue. And then they may have progressive multifocal leukoencephalopathy, PML. Then right here, this is the protozoal infection. So cryptosporidiosis, isosporiasis, micro microsporio microsporidiosis, pneumonocytosis, pneumonia. You got toxoplasmosis. Then for the fungal infections, with fungal infections, you have aspergillosis, Candida disease, stress yeast infection. We know what that is. Y'all see all this. Coccidioidomycosis, streptococcal meningitis, histoplasmosis, other conditions and complications, canker sores, encephal, encephal, encephalopathy, lipotrophy, lipodystrophy, septicemia, low plate count, which is thrombocytopenia, wasting syndrome, a loss of at least 10% of the body. This is probably what we need to know right here. All that other shit, I won't worry about it too much. But this one right here, and probably some up in here somewhere. Probably something. But these, I mean, just become familiar with it. It may say something on the test. The nurse knows that phytozoal infection, which is toxoplasmosis, is what type of infection? Opportunistic infection. That's me just making an assumption if they put something like this on there because we can barely pronounce those damn words. So, like I said, the wasting syndrome, a loss of at least 10% of body weight, chronic diarrhea, severe weakness and general malaise, fever. And then you got malignancies, which is cancer. So you got anal dysplasia cancer, cervical dysplasia cancer, Kaposi's, which is sarcoma, well, Kaposi's sarcoma, lymphomas for the malignancies, and then neurologic conditions, AIDS, dementia complex, HIV associated neurocognitive disorders, and peripheral neuropathy. So go over this like 5 times or however many times you have to go over it. Make individualized cards so you can know, you know, what goes with what. So let's talk about these special considerations. So prevention of HIV/AIDS in the infants, early detection and treatment of HIV/AIDS as part of maternal prenatal care can prevent HIV infections in the newborn. And nurses, period. Nurses must strongly advocate for the HIV testing of all pregnant women. Before 1985, blood transfusion was associated with HIV transmission. This rarely occurs now. Transplants recipients are also potentially at risk. So transplant donors are tested for HIV infections before organ donation. So this is all about the prevention of HIV/AIDS in infants. Now let's talk about these signs and symptoms of the HIV infection. So HIV can be entirely. Hold on. Oh no. I was supposed to scroll the hell back up. So let me scroll back up. Y'all scroll back up. I just had to read that. It's important that you read that box. Let me highlight it. I'm glad I caught myself. We'll go over that again. So since the 1990s, strong combination of meds called antiretroviral therapy have become available. That's what they use for AIDS, well, for HIV. These meds are specifically designed to combat the retrovirus because HIV is a retrovirus. There are a list of the name of these medications in the book. I didn't get them. They're on page 1512 in the new book. So, it's medications to treat or prevent common opportunistic infections. So, y'all look over that. Um, just know what the medications are for. Why do we use these medications? Well, these medications are specifically designed to combat the retrovirus that have exerted a profound effect of the progression of HIV disease to AIDS. HIV process make pharmaceutical destruction of the virus difficult because most agents are designed to attack only one phase of the virus life cycle. Okay? HIV processes make pharmaceutical destruction of the virus difficult because most agents are designed to only well, designed to attack only one phase of the virus life cycle. Like, I'm gonna highlight that because I want to know why is it so hard to basically that's just asking why is it so hard to get rid of it? Why is it so hard for the medicine to kill these cells off? It's very hard. Individuals who take antiretroviral medications often see a drop in the amount of circulating virus and a restoration of immune function as measured by T cell count. So like I said, 85-1, and it's telling us to look at 85 dash 85-2 in the book for the medications that they use to treat, and it's telling us to look at 85-1. Okay, that's this right here. This one right here. So these are HIV medications. These classifications are effective after entering a CD4 cell. And what did we say a CD4 cell was again? The CD4 cell is a T cell. It's a T4 lymphocyte. It's known as the helper T4 lymphocyte. So remember that. So these classifications are effective after entering a CD4 cell. Nucleoside reverse transcriptase inhibitor. Just know these. Just know that these classifications are effective after entering a CD4 cell. And then these classifications prevent HIV from entering CD4 cells. That's entry inhibitors, including fusion inhibitors and integrase inhibitors. That's important to know. Okay, so individuals who take antiretroviral medications, we already said that. Medication therapies have resulted in a significant decrease in frequency of the opportunistic infections and the number of deaths in persons infected with HIV. Also, you need to take a look at the 85-2 chart. Like I said, it said that is the list of medications. So let's talk about the transmission of this disease or this horrible disease. So HIV is transmitted through contact with infected body fluids, which can be found inside mouth, rectum, vagina, and opening of the penis. That's where it's going to be found at the mouth, the booty hole, the cooter cat hole, and the wee wee hole. These areas, like wherever you got a hole except the end of the nose, these areas have mucous membranes lining that have the potential to be abraded, cut, or damaged, which will result in a leakage of blood. So that is why, because these areas have mucous membrane linings that have the potential to be abraded, cut, or damaged. That's the key word right there, because we want to know why can you get it in these areas? Why, if somebody sneezes on you, you don't get it? Stuff like that. Or why, it's pretty much you're doing it. You're gonna get it from having sex, you're gonna get it from sharing needles, stuff like that. So contaminated body fluids include blood, semen, sharing needles. That's that blood, contaminated blood. So you will get it from sharing needles. So contaminated body fluids include blood, semen, pre-seminal fluids, rectal fluids, vaginal fluids, and breast milk. It's all from the fluids. You need to know what are the contaminated fluids. The majority of cases of HIV involve unprotected vaginal, oral, and anal contact. I'm gonna highlight these because you need to know where do this come from. Majority of it come from having sex in a cooter cat, the booty. I mean the mouth or the booty. You can get it from doing oral sex or just dry humping and behind in the anus. I don't know why they didn't just come out and say it. The anus. Um, don't listen to me about that dry humping. But anyway, if an unaffected individual has an open wound, for example, like cut sores, abrasions, inflamed or bleeding mouth or throat, this person can be infected by the blood of an HIV positive person. So who can be infected by that HIV person, positive person? If an individual, if an uninfected individual has an open wound, like a cut, a sore, abrasion, inflamed, or bleeding, or bleeding mouth or throat. So here goes some concept mastery alert. HIV transmission. Methods of contracting HIV includes having vaginal sex with uh, vaginal sex. I'm talking about vaginal. Having vaginal sex with an infected person, sharing infected needles, being in contact with the feces of an infected person, or cleaning up the vomit of an infected person. HIV is not transmitted through the air or through casual contact, such as handshaking. So this right here look like a select all that apply. Methods of contracting HIV. So I will make that red. Having vaginal sex with an infected person, that's A. Sharing infected needles, that's B. Being in contact with the feces of an infected person, that's C. Or cleaning up the vomit of an infected person, that's D. Ha- you know, that sounds like right there. Select all that apply possible. HIV is not transmitted in blood fluids such as saliva, sweat, or tears. You can kiss somebody. You can play basketball with them or go to the gym and they sweat on you. They can cry on your shoulders and you're not going to get HIV. The virus cannot survive in insects. So just because somebody get bit by a damn mosquito, because I saw something that was real mean on Facebook one time talking about Magic Johnson. Somebody said um a mosquito bit him and bit somebody else. Like that ain't how it go. So that's just being mean. So just because you in a group with somebody in a circle and that mosquito bit them, then boom, come bite your ass, you're not finna get no damn HIV. HIV cannot be passed through mosquito bites. See what I'm saying? I just said that. Cannot be passed by no damn mosquito bites. Hold on, let me change you. I don't know why I got all this purple. Kissing does not transmit HIV unless there is some deep open mouth kissing along with some open sores or bleeding gums, which can enable an exchange of blood. I'm gonna put it right there. As HIV and STDs are often co-infection, consider consider also that STDs can be transmitted in some situations that are not infectious for HIV. A contaminated needle or syringe. We all know about that. Not that we do it, but we know about that. HIV transmission. I don't have to finish reading this because y'all know that a person with a contaminated needle or syringe, they can get infected. They can infect the uninfected, a person that doesn't have anything. HIV transmission from an infected pregnant woman to her fetus and to the child during breastfeeding is possible. Protection for the infant is possible and is very effective in the prevention of HIV/AIDS development when the child is treated during the mother's pregnancy. So they can prevent a child from, a mother from passing it on to a child if she get on the proper medicines and do what she needs to do while she's pregnant, while that baby's inside of her. So protection for that infant is possible and is very effective in the prevention of HIV development when the child is treated during the mother's pregnancy. HIV, let me highlight that. HIV infected pregnant women need to be treated for HIV because this greatly reduces the risk of infection in the newborn. Standard precautions are the healthcare workers' primary protective measures against infections carried by body fluid. These precautions are to be used for every client. Additional precautions based on mode of transmission, that is and the transmission based um, precautions are to be used in addition to standard precautions when the client has a known infection like hepatitis or measles. Rarely, a healthcare worker has an accidental exposure to infected blood, most commonly through a contaminated needle. If you fuck around and get stuck with a needle that has, potentially HIV, you're probably going to get it. More than likely, well, yeah, you put yourself at risk for getting infected. Effective prophylactic measures are but must effective prophylactic measures are but must be started as soon as possible after exposure or in less than 3 days. Okay, let me find it because that don't sound right. Hold on. So we're after the concept map, not concept map, but concept map, concept mastery. Come on down. Here we go. They are available. They are available. Effective prophylactic measures are available, but must be started as soon as possible after exposure or in less than 3 days. To protect yourself against needle sticks, never recap a needle. Just throw the damn needle away. Occupational pre exposure and post exposure prophylaxis guidelines are maintained by the CDC. And so this is just some important info. Um, this is in practice, important medication 85 1, HIV meds. These classifications after entering a CD4 cell. So this is what you need to know. And then these classifications prevent HIV from entering the CD4 cell. I think we already went over that, which we did. Went over this already. Make sure you go over that several times. And I read that already, but I'll read it again. Um, Early detection and treatment of HIV/AIDS as part of maternal prenatal care. Get out. As part of maternal prenatal care can prevent HIV infections in the newborns. Nurses must strongly advocate for HIV testing for all pregnant women. Before 1985, blood transfusion was the main cause and the big cause of people transmitting HIV. This rarely occurs now because of the blood banks and the donors, the tests and everything. Even with organ donations, they're going to be tested as well. Signs and symptoms of HIV infection. HIV can entirely be asymptomatic for many years. Many symptoms associated with numerous disorders. These symptoms are, delete that. HIV testing should be considered when there is a history of risk factors. For example, unprotected sex, sharing needles, sexual relationships with an HIV individual. Generally, a more mild symptom occurs in the primary and chronic stages, but if untreated, AIDS will develop. As AIDS manifests, specific disorders are prevalent. You got Kaposi or Kaposi sarcoma is a malignant tumor of the walls of the blood vessels. It's rarely seen in a non-positive HIV individual, but it is very often associated with HIV positive individuals. Then you got wasting syndrome. Now, what happened with wasting syndrome is it's a loss of at least 10%, 10%, 10% of the body weight, accompanied by diarrhea, chronic weakness, and fever, can be reduced by aggressive treatment protocols. AIDS does not appear to infect neurons, which are nerve cells, but AIDS complication can severely affect the nervous system. It may don't fuck with the neurons, it may don't fuck with the nerve system, but AIDS complication can severely affect the nervous system. Neurologic complications lead to the development of confusion, forgetfulness, depression, anxiety, and difficulty walking. Those what the neurologic complications are. There might be a select all apply, may not, maybe so. I don't know. But neurologic complications lead to the development of confusion, forgetfulness, depression, anxiety, and difficulty walking. AIDS, dementia complex, ADC, also known as HIV associated neurocognitive disorder, which is known as HAN, include it includes behavior changes and diminished mental functioning. HIV associated kidney disease, referred to as HIV associated nephropathy, which is HIVAN. This is an inflammation of the renal filters that affect the kidney's ability to remove fluids and waste products. In the presence of these orders, in the presence of these disorders, an antiretroviral therapy may be started, even if the CD4 count is adequate. We're still going to start it. It doesn't matter if the CD4 count is adequate. We're still going to start it. Special consideration, this is for the culture and ethnicity. A genetic predisposition put blacks throughout the world at higher risk of developing HIV associated neuropathy, HIV-AN, than any other fucking demographic population. That's why I don't feel like this was created or passed by no damn monkey. I feel like they put this on us, but that's my feelings. That's a whole nother damn topic that I'm not gonna discuss on here with y'all. Like if y'all want to have one on one, yeah, but no. Anyway, generally the characteristic signs and symptoms associated with infection includes symptoms suggesting primary HIV or AIDS. So the person might have fatigue, recurrent headache, um, lymphadenopathy, persistent enlargement of the lymph. There may be some diarrhea going on, general malaise, profound or unexplained fatigue, anorexia or rash, elevated viral loads seen in primary um, HIV and AIDS patients, oral thrush, herpes infections or shingles, pneumonia, memory loss, soaking night sweats, white spots or unusual lesions on tongue or in the mouth, skin or rash or bumps. Have y'all ever saw anybody with AIDS before? I have. I saw somebody with AIDS. It was no longer HIV, and it was bad with the bumps, the skin rash all over her body, anorexia. She looked just so bad. She was drying up. It's just horrible. And she eventually died some years ago. She was a young lady, like 20 something, 30 something. But um symptom suggestion, AIDS. So like I said, Kaposi sarcoma. It's a cancerous tumor of the blood vessels, and it's appearing as red, brown, pink, or purple spots on or under the skin, inside the mouth, nose, or eyelids, and internal organs such as the GI tract and lungs. Tuberculosis, AIDS, dementia complex of hand. Y'all know what the hand stand for. Go back and look at it if you don't. Go back and look for HIV-AN if you don't know that one either. Uh, wasting syndrome, excessive weight loss with chronic diarrhea, weakness, and fever. You got lymphomas, which is a cancer of the white blood cell originating in the lymph nodes, seen as painless swelling of the lymph nodes of the neck, armpit, or groin area. Lipoapatry, loss of fat in the face, legs and buttocks. This is just and lipodystrophy, excessive fat buildup on back of the neck and shoulders, breast or abdominal areas. And with this, it's just like like the wasting syndrome, like they're withering away. Okay. Um, a key concept to remember: the listed the listed above can be linked to an assorted infection to or disorder and are not exclusively found with HIV or AIDS. The only way to identify an actual infection is to get a accurate testing for it. So just because those people have some of these signs or whatever, that doesn't mean they got AIDS. That's not what that means. Okay. Let's talk about these diagnostic tests. So, boom, the accuracy of lab tests, especially if the tests are diagnostic, it is critical for the healthcare of individual. HIV testing offer scrutiny and lifetime implications. HIV testing offers additional scrutiny and lifetime implication. I already read that. CDC provides recommendation for HIV testing by labs recognized as official testing site in the U.S. Testing for HIV is done in stages or per an algorithm. It's going to be done in stages or per an algorithm. An algorithm is a sequence of tests used in combination to improve the accuracy of the lab diagnosis of HIV. The first phase is to confirm the presence of HIV, which may be done more than once. Initial testing may be a false positive or rarely a false negative. The second tier of testing determines the specific type of HIV, that is HIV 1 or 2. Healthcare and med decisions are based on the results of the test. Diagnostic testing for HIV includes antibody testing, antigen antibody test, and nucleic acid test, which is RNA test. Antibodies test detects antibodies that are made as an indirect response to HIV. Antigen and RNA tests detect HIVs directly. The first tier of testing for HIV will be an antibody test or an antigen antibody test. Okay. Blood or oral fluids, talking about fluids are going to be examined in the lab for a rapid test. Blood tests can detect HIV infection sooner and after exposure than oral fluid tests because the level of antibodies in the blood is higher than it is in oral fluids. So you got an antigen antibody and RNA test detect HIV infections in blood before antibody tests. A test for the HIV antigen, a protein produced after infected or well after being affected, can quickly confirm a diagnosis. And then some antigens, antibodies lab tests can find HIV as soon as 3 weeks after exposure to the virus. No antigen, antibody, or RNA tests are available for oral fluid. I think that's something that they would throw on the test. Key concept to remember: remember that antigens are proteins that stimulate the immune system to make specific antibodies, antibodies that specific act specifically against the antigen as part of the immune response. Let me take a little break to let my dogs out. Okay, so let's talk about these enzymes linked amino assay. We know her as, we call her Elisa, Elisa. I just say Elisa, Elisa. So this is the first test. It's usually ordered to test for HIV. It's the enzyme linked amino assay, which is ELISA, or they call it EIA. So it's the first test ordered to test for HIV. Don't highlight all this. So a false positive may occur if the individual has syphilis, lupus, or Lyme disease. So if that person has syphilis, lupus, or Lyme disease, it's going to be a false positive. If the test is positive, another test is usually done to confirm the diagnosis. Okay, so a false negative HIV, I'm gonna highlight this. A false negative HIV result may mean that the testing has been done too early. Testing has been done too early. False negative, just too early, before the body has produced enough antibodies to the virus to be detected. Enough antibodies, yeah, to the virus to be detected. So the early sign is referred to as window period. Well, that's the early stage, I mean, early stage. And the window period can range from 2 to 4 weeks or about 25 days on an average. So in some cases, months may be needed before an accurate HIV positive result is obtained. During this time, the healthcare providers may initiate therapy based on lifestyle and possible risk factors. If the test is a rapid test, a test done in a home or clinic, the next test will be done in a lab. Typically, the Western blot test confirms the HIV diagnosis. Both ELISA and Western blot test detects HIV antibodies in the blood. And if the, let me highlight that. And if the initial test is negative, a future test may be scheduled after antibodies have had a chance to develop. Retesting is usually scheduled for 4 to 6 weeks. 3 months or 3 months to 6 months, 3 or 6 months after exposure to HIV, depending upon the situation. So if the initial test is negative, a future test may be scheduled. After antibodies have had a chance to develop, retesting is usually rescheduled for 4 to 6 weeks. 3 to 6 months, 3 or 6 months after exposure to HIV, it's just depending upon the clinical situation. I want to bring that over. So we need to know about these weeks and months. That's how I feel. So, key concept to remember: a rapid test is, and I'll make that red. A rapid test is the term for a preliminary HIV test that is performed outside the typical lab. For example, in the home or in the clinic. It can give results in less than 30 minutes. Going to get results back in 30 minutes. Rapid test results can vary and may not be accurate. They may not be accurate and they vary. All positive results must be followed up by additional lab confirmations tests. And initial negative result may be when it may not be accurate, and additional testing may be necessary. If HIV is suspected, preliminary testing includes the following: ELISA, followed by the Western blot, CD4 count, viral load, CBCs, blood chemistry, urinalysis, with testing for sexually transmitted disease, STDs, testing for hepatitis, TB, toxoplasmosis, nursing consideration, and HIV testing. Testing for HIV is associated with many legal implications, although the laws vary from state to state. They generally hold that an informed consent must be obtained from the client before test. You can't just test anybody for HIV and you don't have an informed consent. Pre and post test counseling, usually by a state approved HIV counselor, is required regardless of the test results. This may be a select all that apply. Results cannot, that whole sentence is important. Results cannot be given over the telephone. Most laws identify specific standards for when and how the results can be given and to whom. So we're never going to give a result over the telephone. Ensuring client confidentiality is essential. Most labs, that's I'm not highlighting that because that's common sense. Most labs use a coding system rather than the client's name. The lab must be approved by the state for HIV testing. Okay? Most labs use a coding system rather than the client's name, and the lab must be approved by the state for HIV. So look over these things. I feel like that's important. That's why I highlighted the whole thing. Nursing alert: person with HIV can be asymptomatic for many years. The individuals who have not been tested may not know that they are affected. Women's concern: women should be aware of HIV infection may be overlooked and attributed to other disorders, such as genital ulcer disease, STDs, HPV infections, and PID. Although women may experience the characteristic signs and symptoms more commonly, women experience gynecologic problems as the initial clinic manifestation. A woman going to come in because she got some gynecologic problems going on. And women, that might be important to know. In women, other common HIV-related signs and symptoms include recurrent vaginal candidiasis, how you pronounce that? Menstrual abnormalities like amenorrhea may have an absence of periods, or bleeding between periods. Abnormal pap test, cervical cancer. Okay. So treatment. The main treatment concepts, I was just reading that again to make sure. Let me read that again. And women, other HIV related signs and symptoms, recurrent, oh yeah, this might be a select all that apply. That's why I was looking at it. Recurrent vaginal candidiasis, menstrual abnormalities, like they're not having a period, absence of periods, or bleeding between periods, abnormal pap, cervical cancer. Treatment. The main treatment concepts of HIV are to use meds specifically designed to come back a part of the retroviral replication cycle for HIV. The current antiretroviral drugs include 5 classes. Therapy consists of a combination of these 5 classes. The drugs are collectively referred to as antiretrovirals, also known as orals, or highly active antiretroviral therapies. That's HART or ART, or just as the cocktail. Okay? I didn't heard of that before. Because each classification is designed to attack a different development cycle of the virus. The use of different drugs simultaneously, meaning together, they're doing it together, is more effective in control controlling the amount of the virus in the individual. This often results in a lowering of viral load. Refer to table 85-1. So let me see what 85-1. Okay, I see it. No, this ain't in practice. Where's table? Oh, that page 1511. That's the one that got a whole bunch of different opportunistic infections and conditions related to HIV. We already went over that. So go back to 85. Um, oh no, that's box. Okay, so I'm right. 85-1. It says in practice. I don't want to know why I got that two times. Let me see what in practice that on here. No, that ain't it. Okay, well, oh, okay. You're referring to the table and this chart right here. This chart is on page 1512. Now, where is this at? Let me find my in practice important medication. Um, let's see. I don't see it. No, no, it's in here. Hold on. I think hmm, that's not like me. Oh, that this is the box. I don't see. I guess I didn't put the in practice. Go to page 1511 and you'll see the in practice. I'm not going to add it. These, let me see. These classifications are effective after entering ACD4 cell, nucleoside reverse transcription. I might add it. Just go to page 1511. Look at that in practice box. Now this is in the new book. It's a box at the very bottom. It says in practice important medications 85-1 HIV medication. So just go take a look at that box. I really thought I put that box up in here. I'm flabbergasted I didn't, but oh well. So the table also summarized the main course of actions of each classification with strong suppression of the virus through multiple drug therapies. The immune system may be able to repair. Clients often have an increase in their T cells. There's going to be an increase in the T cells. As a consequence, they are less susceptible to opportunistic infections. Some opportunistic infections can be treated and are prevented with meds. Antiretroviral therapy is often associated with significant problems. Many of the drugs produce side effects, such as severe GI issues, like GI upsets, nausea, vomiting, diarrhea, lipo, lipotrophy, lipodystrophy, bone marrow suppression, and peripheral neuropathy. Treatments for HIV requires knowledge and experienced professionals. Medical regimens usually mean lifestyle changes, at least initially. Illness such as diabetes and illnesses such as diabetes and increased cholesterol or triglyceride levels can become life threatening. Some clients can tolerate medications for only a short period because of toxicity. So, key concept to remember, HIV is not curable, it is only treatable. And I already said that. It is not curable, it is only treatable. Okay. So this is the box in 85-1. Like I said, well, this is a table, not a box. This is a table. There is an in practice important medication that is 85-1 HIV medication, Go and look at that. Like I said, in the new book, it's 1511, and just go and look at it. It start off with these classifications are effective after entering a CD4 cell, and then it tells you the classification. And then these classifications prevent HIV from entering the CD4 cell. That is important. I will add that in here, and it's going to be highlighted because I feel like that's important. It's talking about the classifications that are effective after entering the CD4 cell, and the classifications that prevent HIV from entering that CD4 cell. Okay, so the table 85-1 classification HIV/AIDS meds. So these are, how many are these? One, two, three, four, five, six, seven, eight M's. Okay, so this is what, five? One, two, three, four, five, six. Okay, so classifications and how they work. An example: nucleoside or nucleotide reverse transcriptase inhibitors. So that's NRTIs, how they work. You need to know how they work. Know some examples, but not, I wouldn't go, I wouldn't go too deep up in this right here. This is what I'm looking for. The classifications and how they work. This is what I would study. This is too much. I don't feel like they're going to give us this. Not on no finals. Hell no. Hell no. Now, when we have all that other stuff to study, I don't see that. So let's go through. I'm going to go through these two. Now, you want to be fancy? Take your ass through that, but I'm not going through that. So classification, nucleotide reverse, with NRTIs, right? What they do is, how they work is, they're going to replace part of the HIV genetic material with alternate enzymes, which means that the virus does not have access to normal development, normal developmental life cycle. Thus, the cell is prevented from producing new virus. So remember that. In our RTs, replace part of HIV genetic materials with alternate enzymes, which means that the virus does not have access to normal development life cycles growth. Thus, the cell is prevented from producing new virus. Now, with this one, the NNRTs, where it's non-nucleoside reverse transcriptase inhibitors, they attach themselves to reverse transcriptase and prevent the enzymes from converting RNA to DNA. They're preventing the enzymes from converting from RNA to DNA. That's what these inhibitors do. Okay, that's what they do. They attach themselves to the reverse the transcriptase and prevent. This is the thing that's important. They prevent the enzymes from converting RNA to DNA, because that's what the HIV cells. The HIV cells, they use their RNA to change the DNA of a person. So HIV genetic material cannot be incorporated into the normal genetic material of the invaded cell. The cell is prevented from producing the new virus or producing new virus. The PIs, which is protease inhibitors. PIs, they disable a protein, which is protease. That's why it's called this protease stands for protein. So if you see protein and protease, and you see that in the like in a question, you know what? Okay, PI is protein. They're going to disable that protein that the HIV needs for replication. So you know that HIV needs proteins to replicate. So the protease inhibitors mean they're blocking. Entry inhibitors, including fusion inhibitors. What they do is, entry inhibitors, they're going to work by preventing the HIV from entering. That's why it's called entry. Entry. So entry inhibitors, entry blocks, including fusion inhibitors, block. That's what inhibitors mean. So entry inhibitors work by preventing HIV from entering healthy CD4 cells by blocking specific proteins on CD4 cells. This classification may be especially beneficial to HIV positive individuals who have become resistant to some other classification. And then you got integrase inhibitors. Integrase inhibitors work by blocking a protein that the HIV used to infect a CD4 cell. So when I see integrase, I'm thinking of integrated. So integrase inhibitors, they're going to work by blocking a protein that the HIV uses. So the HIV is integrating with the protein and it's using it to infect a CD4 cell. So when you see integrates, think of the HIV getting with a protein. They're integrating, meaning they're getting together. They're not segregated. They're segregated means separated. They're integrating. So HIV have to have that protein and it uses it to infect a blocking CD4 cell. So integrase inhibitors work by blocking a protein that the HIV uses to infect the CD4 cell. Immune-based therapies. With immune-based therapies, so therapy is going to be, we know that's research, right? So that's the whole thing right there. The therapies and the research. Okay. Um, you know what? I'm thinking about theory, but hell, same thing. Immune-based therapies. Research is suggesting that an HIV-infected person can benefit from therapies. Yeah, I didn't mean. I'm thinking about theory. Okay, so research is suggesting that an HIV-infected person can benefit from therapies that combat the virus by using one's own immune system. So if you see immune system and immune base, you know that research is suggesting that an HIV infected person can benefit from therapies that combat the virus by using one's own system. That's the one's is the person, their own immune system. So immune base, we're going to use that person's own immune system. Important proteins called cytokines, such as interleukins. We learned that in the last thing. This is the shit that Nurse Griggs showed us that was pertaining to the little girl that had cancer and you know it had something to do with I think this is exactly what it is. Like they used some type of AIDS and injected the little girl with it to help fight those cells. So such as interleukins 2 can affect immune cells. Immune boosting drugs may be found in vaccines or hormones. Okay. So this is yeah, that's what it is. The HIV-1 immunogen. This is what they're going to use. This is the video that she showed us. I know what the hell I be talking about, y'all. So examples. That is the drug that they inserted in that little girl to help her fight the cancer. Okay, just make sure you know all this shit. I want too much focus on these. That's too much. I want focus on these. If anything that on the test may ask a question like, um, for the classification. Um, so this is going to be a classification. So hell, let's just use the HIV-1 immunogen is used for what? What is its classification and how does it work? Its classification is immunobased, or a nurse knows that HIV-1 immunogen classification is what and how does it work? I mean, it may not be like that, but you know, the classification is it's an immune-based therapy, and we know that no, that ain't what it's going to say. The test may say the HIV-1 immunogen is classified as an immune-based therapies, and immune-based therapies work by, and it's going to mix these up, and you got to know if you know this what you study. You study the classification. They're going to put that drug with the classification. I feel it because we can't learn all this shit in it ain't gonna happen. So they're going to say something like that. The HIV immunogen is an immune based therapy, and it works by. Does it work by entry inhibitors? Work by does it work by preventing HIV? Nope. Does it work by attaching itself? Nope. Does it work by suggesting that an HIV infected person can benefit from the therapy that combat the virus by using one's own immune system? Yes, that's how it works. And you're going to know that because you're going to see that keyword immune system. Okay. And then just look at that word immunology. So this is AIDS. Let's talk about AIDS real quickly. We're almost done. So HIV positive individuals with a T cell count below 200. You have to know that. Belongs in the group of individuals who may be considered to have the diagnosis of AIDS. As the virus progressively destroys the immune system, a variety of infections and cancers can develop. Person with HIV in certain um, opportunistic infections or cancers also are considered to have AIDS. Um, AIDS occurred during the later stages of HIV. We already said that. AIDS occurred during the later stages of HIV. Some individuals seem to maintain a healthy immune system for many years despite HIV infections without the use of meds. The reason for the delayed development of AIDS are they don't know. So, like I said, as the virus complete progressively destroys the immune system, a variety of infections and cancers can develop. Okay. So, key concept, early detection. I just had to read that again. Okay, so key concept, early detections of HIV, opportunistic infections, and AIDS allows for more options in treatment of infections and preventative measures. So, make sure you know that. Early detection of HIV, opportunistic infections, and AIDS allows for more options in treatment and of infections and preventative healthcare. Just think of it just like with cancer and the early detection of cancer. Opportunistic infections. When an HIV positive person T cell counts falls below 200 or 400, know this. You got to know this. You already know about this one. The count below 200, that's AIDS. But with the opportunistic, when it falls between, I'm sorry, not below, but when the HIV positive person T cells count fall between 2 and 400, the first opportunistic infection may appear. Oh, listen, boy. That might be on the test. Initial infections of the skin and mucous membrane, such as oral, thrush, shingles, and severe athlete's feet, may develop. Wow. Wow. Initial infections of the skin and the mucous membranes, such as the oral thrush, the shingles, and athlete's feet, severe athlete's feet, may develop. Ain't that something? I'm gonna highlight it. Okay, so you see a man with some crusty ass feet and they severe, you better think about twice before you pull them draws down. I'm just letting you know. So as immunity diminishes further, more life-threatening infections are likely to occur. As immunity diminishes further, more life-threatening infections are likely to occur. So that's going to be in box 85-1. That's going all the way up. We already went over that box. Go over that box again and again and again. You already know shit from that box is going to be on the test. So a variety of fungal, viral, parasitic, and bacterial infections may occur, causing problems such as wasting syndrome, HIV/AN, and neurologic disorders like AIDS, dementia, complex, or hand, HAND. It ain't the hand like your hand, but that's HAND. It stands for something. We already read it. If you don't remember what HAND means, go back up to a couple of pages up. Well, not a couple of pages, it was like in the beginning of the chapter, and HIVAN, and try to remember what that means because I didn't forgot. I gotta go, and I'm not going back. Now in figures 85-2 and 85-3, let me see what page that's on. You got oh, that's these folks right here. Wasting syndrome. He got wasting syndrome. He losing a lot of weight. And he got Kaposi sarcoma lesions all over him. This is what the lady that I told y'all earlier, the young lady that died. This is exact. She was thin as wind, and she had these sores all over her body. I'm sorry, I ain't trying to be that loud, but oh, she looked so bad. I felt so bad for her. So as immunity, okay, so as immunity diminishes further, more life-threatening infections are likely to occur. Okay, a variety of fungal, viral, parasitic, and bacterial infections may occur, causing problems such as wasting syndrome, HIV/AN, and neurologic disorders, which is AIDS, dementia, complex hands. Okay, I just said this shit again. So Go look at that. Go look at that. These two right here. This is the wasting syndrome, and this is the Kaposi sarcoma, the lesions. So the nurse, these are lesions called Kaposi sarcoma. This is wasting syndrome of acquired immunodeficiency syndrome, AIDS in the later stages of AIDS. The client, that's supposed to be the client loses weight and is susceptible to many opportunistic infections. The nurse and caregivers need to be aware of more common opportunistic infections, which include the following: candidiasis, that's the yeast infection; thick white coating, the like cottage cheese; cryptococcal meningitis; cryptosporidiosis; cytomegalovirus. Let me herpes simplex, histoplasmosis, mac and cheese, but that's not mac and cheese. That's Mycobacterium avium intracellular, pneumo, pneumonocytis, pneumonocytis, gyrovasi, carini, pneumonia, they call it PIP, formerly PCP, toxoplasmosis, I would know these, TB. I know of people who have had, came to the hospital and they had pneumonia. They call it pneumonocytis, the PIP. They come in and they got the pneumonia and it's related to AIDS. So, these are all of the opportunistic infections. So let's read what they are, because if you're skipping over shit and you're not reading it and it's on the test, you're gonna feel real fucked up. Like, study this, and know what the hell they do. We know this is the yeast-like fungus causing thick white coating on the mucous membrane of the mouth, thrush, tongue, esophagus, or vagina. That's the candidiasis. Look, I be fucking these words up, but let's keep going. Cryptococcal meningitis. This is a fungus that is found in the soil, causing inflammation of the membranes and fluids surrounding the CNS, which is the central nervous system, the brain, and the spinal cord, meninges. This is a cryptosporidiosis, and it's an intestine parasite commonly found in animals that is passed through contaminated food or water. It grows in the intestines and bowel ducts, leading to severe chronic diarrhea or diarrhea of AIDS. Cytomegalovirus, CMV, it's a herpes virus transmitted in body fluids such as saliva, blood, urine, semen, breath. If it develops, it causes damage to the eyes, digestive tracts, lungs, and other organs. Herpes simplex, a viral infection causing a variety of problems, including colitis, pneumonitis, and retinitis. Histoplasmosis, fungal infection caused by inhaling spores of a fungus often found in birds and bat shit. Mycobacterium avium intracellular, that's the mac and cheese. Well, it's not mac and cheese, but bacterial disease with fever, malaise, night sweats, um, anorexia, diarrhea, weight loss, and lung and blood infections. Pneumonocytosis, the PIP, formerly known as PCP. One-celled organism causing infection of the lungs with a cough, fever, chest pain, and sputum production. You got toxoplasmosis. This is a parasitic infection. It's spread by cat shit, which can spread to other animals and humans. It involves the brain, lungs, and other organs, causing fever, chills, visual disturbances, confusion, hemiparesis, and seizures. And TB, tuberculosis, a bacterial infection causing the growth of nodules, tubercles in the tissues, especially the lungs, and the most common opportunistic infection and a leading cause of death in individuals with AIDS. TB. Treatment. The ideal purpose of management of AIDS involves the prevention of opportunis- opportunistic infections when possible and the early treatment of such infections when they occur. The prevention of HIV is non-infected individual is referred to as pre-exposure or pre-exposure prophylaxis PrEP and post-exposure prophylaxis PrEP, which are discussed. We'll discuss in a second. The use of antiretroviral meds has resulted in the decline or delay in the number of individuals who progress from HIV to AIDS. When T cell counts are low, prophylaxis is commonly given to prevent opportunistic infections, including PJP and MAC, which is Mycobacterium avium intracellular and monocytitis. Well, yes, pneumonocytis gyrovici pneumonia. I know I fucked it up. Mortality. HIV remains a leading cause of death in individuals between the ages of 25 to 44. Mortality due to HIV rapidly increased in the 80s, and the peak was 1994 to 95, according to CDC. A variety of available meds and aggressive treatment. The mortality rate decreased rapidly through 97 and has continued to slow the fuck down. Demographic groups of concerns for HIV morbidity and mortality includes women, African Americans, residents of the South, Louisiana, goddamn it, ooh, and individuals, ooh, 45 of age or older. You'll be surprised of all of the old folks that come through the emergency room with HIV. You will be surprised. A lot of males and women coming through, all ass people coming through with their shit, you know. It's crazy. It's sad. Paying prostitutes to have sexual relations or escorts to have sexual relations, passing it on to your wives or passing it on to your husbands. It's just crazy. You will be shocked of the stories I have heard. I'm not gonna tell you who told me because that ain't none of your damn business. But just know you'll be shocked. And there might be a select all that apply. And like I said, HIV clients can delay the onset of AIDS for several years if they do the fucking antiretroviral agents. Take your drugs. So, for nursing alert, confidentiality is always a concern for healthcare professionals. For clients with HIV/AIDS, nurses must be diligently alert to the confidential nature of the disease. So, nursing implications for the client with HIV. Although many HIV infected persons can function fully and do not require specialized care beyond that provided by their primary care providers, nursing care can be very helpful in many instances. For examples, it is essential to take prescribed antiretroviral agents as directed, and person with HIV often requires assistance with med adherence. So we're going to teach them, take your damn medicine, and this is why you should take your medicine. That's our job. The nurse can help in the planning with the client on how to take each dose, provide suggestion for pill boxes and calendars, you know, shit like that. Assist in management of side effects, aid in obtaining refills on time, and teach so that the client and family understands interactions that might occur with food and drugs. The nurse plays a key role in the client and family, teaching about all aspects of the disease. Y'all know what we got to do. So this is 85-1, the key teaching topics for understanding HIV and AIDS. We're going to teach the client and educate the client about the disease process and the signs and symptoms, ways for transmitting and not transmitting the HIV, infection control measures, proper disposal for sharps and contaminated objects, maintenance of hygiene in that kitchen, possible side effects of meds, nutritional plans, including the use of dietary supplements, psychological support, available community resources and services to provide home management, and sources for hospice care. So this is important to know. Might be a select all that apply. Key concept: HIV cannot invade the body through intact skin. Therefore, skin is an excellent barrier. Skin is an excellent barrier to protect yourself from HIV. Just because somebody sneeze on you or somebody, you know, put blood on you and they have HIV, your skin is protecting you from getting it. That's different if you had a break or tear in the skin. That's totally, totally different. So, special consideration lifespan, HIV and aging. HIV and its treatments can complicate the aging process. Healthcare for the older population typically include heart disease, hypertension, diabetes, cancer, respiratory problems, which may need pharmaceutical or surgical therapies. Potentially hazardous interactions may occur. So just look over there and remember that HIV and its treatments can complicate the aging process. So let's talk about this key concept: HIV medication therapy demands strict adherence to a complicated regimen. The client and the nurse must be aware of the requirements of each medication. We already talked about why they got to take their medicine, so I'm not even going to go into depth on that. So, the psychosocial aspect of being infected with HIV may be significant. Persons are stigmatized. They may lose the support of friends and family, and they may find a restraint on sexual activity difficult because don't nobody want to have sex with somebody that has HIV. Let's just keep it 100, okay? So they're looking at you like, oh hell no, everybody know how it is. I'm not even gonna sugarcoat it. That's how it is. So support from healthcare professionals can assist HIV positive clients to adjust to the diagnosis. The nurse can make referrals for psychosocial care to counselors and support groups. Some HIV infected individuals choose to return to school and work and may benefit from referral to retraining programs or educational counselors. In addition, it is so important that those who are infected know how to prevent transmission of HIV to family, friends, and sexual partners. So, nursing alert: condoms do not guarantee safe sex. They provide safer sex. So, don't come up in here with that. I'm recording myself because I can't see. Anyway, what's up? So, nursing, my bad. So, nursing alerts: condoms do not guarantee safe sex. They provide safer sex. So, it doesn't matter if you use a condom with somebody that has HIV/AIDS. You can fuck around and get it. It doesn't matter. So, it just provides safer sex. That's all it does. What if that condoms break and that person, had a tear or bleeding on the inside? You put yourself at risk for getting AIDS or with HIV/AIDS. Nursing complications for clients with AIDS. Individuals in later stages of the disease are more likely to require special nursing care because of their weakened condition. They may, well, they many, the many require. I think that's supposed to be may. Hold on. They may require total nursing care. Some may be able to stay home during their final days. Family members need education about what this entails, and that's going to be in 85-2 box. Let me find it. Okay, I think I got that in here. This 85-2 box. So let's talk about it, and then we're gonna scroll back up. Home care for the person with HIV/AIDS. It is important that the client and family understand how the human immunodeficiency virus (HIV) is transmitted. Infection controls are essential, so always use standard precaution. Gloves should be worn during contact with blood or other body fluids, or at any time blood or body fluids, including urine, feces, or vomit, may be present. cut sores or breaks on the caregivers and clients' exposed skin should be covered with bandages. Hands and other parts of the body should be washed immediately after contact with blood or other body fluids and surfaces. Soil with blood should be disinfected appropriately. Practices that increase the likelihood of blood contact, such as sharing of razors and toothbrushes. You don't do that shit. Avoid it. Who in the hell? See, there we go with the toothbrush shit again. I already told I put a toothbrush in the dishwasher. Now motherfuckers sharing toothbrushes and razors? Okay, whatever. Needles and other sharp instruments should be used only when medically necessary and handled according to recommendation for health care settings. That's why a lot of needle people get it. Do not put caps back on needles. Just throw the damn syringe away. Do not put caps back on needle by hand or remove needle from syringe. Disposes of needles in puncture-proof containers out of reach of children and visitors. Okay, so let's scroll back up. So just know some may be able to stay at home during the final days. So opportunistic infections require special medication, and clients may need assistance in taking these properly or in contacting the healthcare provider when problems develop. Intravenous medication it may be used, and with such meds comes the associated care of venous access lines when a person is in. Hold on. Let me read that again. Intravenous meds may be used, and with such meds comes the associated care of venous access lines. So they may have to do that, just like they do cancer patients. So when a person is in the terminal stages, of AIDS, the focus is on providing the client with comfort. Emotional support combined with technical skills will help clients. It's some biscuits in the oven. Emotional support combined with technical skills will help clients and families cope with the illness. The nurse may need to schedule regular meetings to provide education and resources. Now, for evaluations, the entire healthcare team, client, and family will evaluate outcomes of care. Have short-term goals been met? For example, is the client adhering to the prescribed med? Like, are they doing what the fuck they supposed to do? Are they taking the meds like they should? Are the clients and family beginning to discuss the disease and its care? Is there any, long-term goals? Are they still realistic? What community services are required? Is the client in need of home care services? Does the client need financial assistance? All of that is a referral for psychiatric care indicated. Planning for further nursing and healthcare considers the client's prognosis and responses to care. So just know that why would a referral to a psychiatric be needed? Think about somebody telling you, the doctor telling you, you have been diagnosed with HIV. You don't think you're going to need a psychiatrist? Well, everybody probably don't need a psychiatrist, but if I was told that, oh, I need psychiatrist because I'm going to flip the fuck out. Okay. So HIV exposure guidelines. Prevention is the key to future HIV outcomes. Prevention is the future. Currently, there are no cures or vaccines available. We already said that. No cures, no vaccines for this shit. So the vaccines is trying to stop you, or not stop, but trying to prevent it from happening. I mean, it ain't guaranteed. So it ain't no damn vaccines to help, like the HPV, is out there to help try to prevent you from getting cancer. So consider that 50,000 new cases occur per year in the United States. Do you know that's a lot of cases? 50,000. The healthcare needed for an infection that devastates the immune system involves the high levels of daily care, psychological adjustments, financial obligations, and approaches to personal relationships that include acknowledgement of HIV status. Now, we already read this box. Read it again, and read it and read it and read it. PrEP and PEP. There are two basic types of information available regarding protections against HIV infections: before exposure of PrEP and after exposure of PEP. According to the CDC, the word prophylaxis means to prevent or control the spread of an infection or disease. PrEP is used for prevention of infection with HIV. PrEP is intended for individuals who are at high risk of getting HIV. For example, a sexually active partner of an individual who is HIV positive. I was trying to see what is, I didn't know the name of this med. Okay, so it's a PrEP. So this is the med that a person would take when they are not HIV positive, but their significant other, or because it got to be a significant other. It cannot be a boyfriend or girlfriend. Like it. Whew. I mean, I just saw videos on YouTube where people, whew, I couldn't do it. I'm not going to judge no damn body because I don't know how a person could have gotten AIDS. So or HIV. I would not judge anybody. But there are some people that still are able to date and they still will talk to someone that has this virus. You don't have to just talk to somebody that has HIV. So you give this person a PrEP. That person, the person that's not infected, will take the PrEP. The PrEP method is designed to be used consistently. They got to take this pill every day and is used with other prevention option, which is condoms. Take that pill every single day. PrEP may be an option for individuals who are exposed to HIV frequently. Hell, I probably have to take this pill if I'm working with a. Look at me. I'm not gonna do it. I was gonna say if I was working with somebody with in the healthcare, but I'm not having sex with nobody that got this. So, mm-mm. Just gotta be careful. Make sure you don't get stuck with no needle and do what you're supposed to do. But anyway, the individual who may initiate PrEP needs to understand that they must take the med daily and use other prevention tools such as condoms. I already said that. It just wants you to know that shit again. So let me highlight that. Side effects of the meds include headaches and GI distress, which seem to diminish in about a month. PEP is used within 72 hours or 3 days after a single high risk event. PEP is used, you need to know that. And let me see if it say PEP 2 times instead of PrEP. Yep. PEP is used for healthcare workers who look. Okay, so healthcare workers can use it. So PEP is used for healthcare workers who have had a single event of exposure to blood or body fluids that are infected or whose infectious status is unknown. This sounds like a plan B. The goal is to stop HIV from making copies of itself and spreading throughout the body. It is imperative. Hold on. It is imperative to take the antiretroviral medicine ASAP to prevent becoming HIV positive. Yep. Sound just like a plan B trying to prevent you from getting pregnant. 2 to 3 types of meds are taken for a duration of 28 days. Nausea is the most common side effect. People are going to be taken for a duration of 28 days. After the 28 days of treatment, the individual is rescheduled for HIV testing at 4 to 6 weeks, and then at 3 and 6 months. PEP is not 100%. effective, it does not guarantee that a person newly exposed to HIV will not become HIV positive exposed to the virus. Damn, that's fucked up. So it will be necessary for the individual to continue to use condoms until HIV negative status is confirmed by a lab at 6 months. Wow, 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 wow. I'm gonna highlight these two. Okay. Go to the CDC website for all that other information. As a nurse, it will be your responsibility to be aware of protocols, counseling, labs, and following follow-up testing will be included as part of PrEP and PEP. Disclosure HIV status. Okay, with the disclosure, it's difficult for a person to take, personal responsibility. Disclosure of HIV is a difficult personal responsibility and may also be a legal requirement. That shit is legal. Ain't no may also, it is. Got to tell somebody you got it. Notification begins with a positive HIV test. If the HIV test is positive, the clinic, lab, or other testing site will report the results to the state health department. Putting all your damn business out there. If the HIV test is positive, the clinic, lab, or other testing site will report the results to the state health department. Okay? State health officials, known as public health officials, use this info to monitor the status of an epidemic of HIV, as well as many other infectious diseases, for example, syphilis, pertussis, and measles. Federal and state funding of HIV/AIDS services is often based on prioritization of needs. That is to say, where the need is greatest and the epidemic is strongest. The state health department will remove all personal info from the information, which is then sent to the CDC. The CDC is responsible for tracking epidemics and providing resources to healthcare personnel as well as the American public. The CDC does not share this information with anyone, including insurance companies. Partner notification laws are available in many states, and some states do not require the HIV individual patient to tell specific people of their. Don't move to them damn states. The ones that say, or those cities, the ones that say you don't have to tell, you got to tell in Shreveport, goddamn it. Or yeah, the many states and some cities, don't go to them motherfuckers. So these laws require that, and it's called the partner notification law. Sometimes it's required. And then some states, cities and states, the shit ain't required. That is so crazy. These laws require that a positive HIV test must be reported by the individual or healthcare provider to anybody that they finna get ready and screw, okay? Anybody that they banging, having sex with, fucking, you gotta tell them. That's what those laws are in place for. Or any persons with whom the HIV person has shared needles, okay? Even if you share needles, you gotta tell them. Don't tell them and see if your ass don't get locked up for attempted murder. So keep in mind the legal obligations. Hold on, because y'all need to know this shit. So keep in mind that the legal obligations to notify the appropriate agencies and individuals in order to prevent the spread of disease, okay? So failure to provide that notification is, that whole damn, underline this shit. So if the contact, okay, I'm sorry. Failure to provide notifications of positive HIV positive status is a motherfucking crime. If the contact information is known, some health departments require healthcare providers to report positive HIV results to the individuals who share sex or needles with an HIV positive person. A third party notification requires that healthcare personnel reports the HIV status to an individual who has a significant risk for exposure to HIV by someone who is known to be HIV infected. Okay, once again, a third party notification requires the healthcare personnel report the HIV status to an individual who has a significant risk for exposure to HIV by someone who is known to be HIV infected. So that's just, they probably get to asking you who all you had sex with in the last 30 days or in the last day or two or whenever. Like, who all you been fucking? Because we need to call them and let them know. We got to let them know. You know, while it may be moral and mm, mm, mm. while it may be moral, let me see if there's somebody here. If the contact information is known, some healthcare provider departments require healthcare providers to report positive HIV results to the to the individuals who shared sex and needles within. Mm, mm, mm. So while it may be moral and legal responsibility of an HIV infected person to notify any significant other, not all individuals will comply. Mm-mm. The duty to warn is designed to show good faith efforts to notify a partner of an individual who has HIV/AIDS. Notifying others may not be an easy task, okay? It may not be an easy task, but you got to do it. Exposure to HIV may mean revealing personal information such as sexual relationships or drug use. Sexual partners need to know that they may have been exposed. They need to know that. The benefits of reporting can be life saving by notifying. I just think that's so important. By notifying the individuals or the public health department, an HIV infection may be prevented. The sexual partner may be able to receive PrEP or PEP. Education, where educating friends can help others to be more consensuous of the need for protected sex. Since STDs often coexist with HIV, all individuals should seek healthcare advice and treatment if needed. The consequences of HIV exposure presents a multitude of economic and social concerns. The HIV positive individual can prevent others from getting this disease. Since HIV is a lifelong disease, all future contacts contacts need to be notified. The Civil Liberty Union State Criminal Statute of HIV transmission um, keeps a state by state listing of legal requirements, and the ACLU, go to their website and it show you criminal statutes, HIV transmissions. I guess you can see people that probably have unfortunately given people this disease and then tell them that they had it. So that's it, y'all. That's it for 80. Okay.